They have trouble actually getting through their day or even sleeping through the night because they can't sense when their blood sugar is extremely low and potentially even life-threateningly low.
The McGill University Health Centre in Montreal has been designated as Quebec's first and only establishment for islet cell transplants for patients with type 1 diabetes.
It's these people who are most affected by their diabetes and who stand to gain from the procedure, which can restore stability and even insulin independence.
The islet cell transplant is a non-invasive procedure that reestablishes a person's ability to make their own insulin, a life-changing treatment made possible thanks to a pancreas from a deceased organ donor.
And we basically turn this pancreas, which is about 100 grams, into 2 or 3 milliliters of cells that make insulin. We purify just the clusters of cells called islets that make insulin and glucagon and control a person's sugar metabolism. And they constitute only a tiny 1% of the whole pancreas. And we purify those out and we test them. We test their potency, their viability, and obviously sterility. And when they meet certain criteria that we've established and which Health Canada has sort of certified us to achieve, then we can give them to someone, and they're injected into the person's liver.
The MUHC will be the only place in Quebec where patients can access this treatment.
There are criteria for eligibility for the procedure, and there is testing and a workup to be done. From there, a person can be contacted by our pre-transplant coordinator, who would go through some screening questions and maybe some blood tests and such to determine if this would be beneficial treatment for them.
For more, visit isletlab.org. In Montreal, Tenneriello, City News.